So hello and welcome to another episode of In Conversation With, curated by Kangaroo Minds. I am Vedika and today we have with us Dr. Mahesh Balsekar. Dr. Balsekar is a consultant pediatrician with over 3 decades of experience and is associated with several leading hospitals in Mumbai. With a keen interest in social medicine, he is also the founder of a charitable trust, The Healing Touch, and is on the advisory board of St. Jude's. Having attended and presented in national conferences and international conferences, he also has several publications to his name. Our conversation today centers around child mental health. So without taking much time, let's hear from Dr. Balsekar himself. So Dr. Balsekar, in all your years of experience, how have you seen the space of child mental health evolve in terms of the concerns that are coming up? And do you feel that somewhere even the conversations around it are changing?
So mental health has always been a part of pediatric practice. And as you know, about 10% of children have some mental health issue at some time or the other. What people are perhaps not aware is that almost 50% of mental illness comes within the first 14 years of life, and almost 75% in the first 21 years of life. So the onset of mental health problems actually is in childhood. What we are seeing, however, is that the incidence seems to be increasing, and this is a phenomenon which is seen the world over. So similarly, in my 3 decades of practice, I'm seeing an increasing number of patients now, and the spectrum of illnesses has also changed. So, for example, earlier we used to see a lot of behavior problems, some anxiety, some depression. But now we are seeing far larger numbers of anxiety and depression. We are seeing a lot more of eating disorders, which we used to not see much earlier. We are seeing a lot of self-harm and attempted suicide, which we used to not see in the earlier years. So we are seeing not only an increased prevalence, but we are also seeing a much more severe variety. And this is obviously because of the changes in the environment that we are seeing in the last several years.
Right. I mean, you mentioned, that you're having a whole range of disorders now, which are even more intense on that spectrum. Are you also seeing resistance from caregivers to talk about it or to seek help for it?
Fortunately, it's the other way around. We find now that adolescents are actually approaching us for mental health issues. We are also seeing that parents are approaching us for mental health issues. It's not as much as it should be, but it's far better than 10 years ago, 20 years ago. I think it's very important to realize that in a developed country like UK, with a established healthcare system, only about 30% of children or adults who are mentally unwell actually seek help. The number here in India is going to be much, much less. So if it's 30% in UK, it's going to be much lower here. But I feel that in my practice, things are actually improving. A lot of attempts by a lot of organizations, media, celebrities, it is creating an awareness that mental health is here and that we have to identify it and we have to seek help. So I think things are improving for the better.
I think, in current times, we've been in the pandemic for a year and, students have been away from school, they've been away from their peers, they've been in lockdown, and some of them are not in optimum living conditions. For those children, how do you feel that, the COVID has taken an impact on their mental health, and how do you think that's going to impact their long-term development?
So there's a lot of literature now on the impact of COVID on the mental health of children. Now, this you can segregate it according to the age group. You find that the very young children are actually doing well. And the very young children have both their parents at home and everybody, they get a lot of stimulation. So it hasn't impacted the very young. So the infants are actually doing better.
Okay.
You find toddlers where social development is important. They are somewhat hit. So this is when speech is developing, relationships are being formed, they learn to play with others. So social development is taking place. So you find that the 3, 4, 5-year-olds are significantly affected. And this is where parents find a lot of problem because the kids can't go out, they're restless, they need some opportunities to socialize and go out. And the older children who want to go out and play and socialize, and the adolescents, they've been the worst hit. But one thing is clear is that this effect on families is not uniform. And the upper income group with all their opportunities are doing much better. And you find the lower income are doing well. You find kids who were normal earlier are doing much better. We should not forget that children are not a uniform population. You find
Right.
children with pre-existing mental problems. They've been hit hard. You find children with developmental problems. They've been hit hard. Children from lower socioeconomic backgrounds, they've been hit hard. So you find this homeschooling, for example, which everyone's talking about, but not every household has 4 laptops for the house, for the husband and the wife and the 2 kids. They don't have enough space. So
Exactly.
the lower income families have been really hit much worse. So there's a non-uniform effect on kids, and the impact has been very tremendous. Overall, the incidence has 30%. I mean, 30% have had severe mental health issues, and minor issues are probably much, much larger. So I think the hidden epidemic which people talk about is actually the mental health epidemic as a consequence of the COVID. And this is a reality.
Right. I think, as you mentioned, the aspect of the digital poverty and the digital divide has definitely become far more profound today for children. And along with the mental health epidemic, I think is also the sleep epidemic which, children are facing. They're not getting enough sleep because partly because they're not even burning off any energy being, especially with younger children. But moving ahead, I mean, as a parent, caregiver, adult who's, with the child, what would be some early warning signs that you could share, that they could look out for?
Children manifest mental disturbances in different ways. So, for example, you have a very young infant. So, a young child may show developmental abnormalities. For example, the child may walk late, the child may learn to speak late, the child may not socialize properly the way parents expect, the child may not respond to parents. These are signs which you see in very young infants. You might also find sleep disturbances. A child may not eat properly. The child may cry a lot. There may be attachment problems where the mother doesn't seem to get it right and there's no adequate bonding because the child does seem to be quite irritable.
Right.
So these are the various ways young infants behave. Children behave in a slightly different manner. They sometimes become aggressive. They start hitting. They also have sleep problems. They have eating problems. And that's how older children behave. Sometimes they have regressive behavior. They may start bedwetting, or they may start thumb sucking. So these are some of the problems older children manifest. And the older children who can communicate, they actually come forward with clear symptoms and of anxiety and depression and not feeling okay, and social problems, relationship problems. They come with substance abuse, alcohol, these kind of problems the older children come with. So the spectrum is quite wide across the.
Okay, so in terms of, let's say an adult has noticed, that the child is having certain mental health disturbances, or they've noticed some of these signs. How would you recommend, the first step to seeking help? Because not everybody would be very open to, straight out going to a counselor or a psychologist. But how can we ease that process and how can they seek help to start with?
So I think the first thing is recognition. And it's quite amazing that all of us pay so much attention to our physical health. Everybody's talking about diet and exercise,
Right.
but not everybody talks about mental health and how we can identify it early. So this becomes a largely neglected and taboo subject. Fortunately, things are better. So I think it's very important for parents to realize that children don't come with mental illness. They come with behavior problems. They come with symptoms. For example, a child may come with recurrent abdominal pain. A child may come with severe headaches or migraines. So you have different manifestation of mental illness. If things are not going quite right, then the parent should always be alert to the possibility that it may be a mental health issue. Sometimes the child have problems. So parents should always think that not why the child is behaving in such a way, or rather not what the child is doing, but why is the child behaving in a particular way. So once the parents are sensitive for this, I think it's not very difficult for parents to identify. So the most important thing is to acknowledge that mental health issues are common in children. and to be aware that it exists and to realize that children manifest in different ways. It's most unfortunate that even severe cases of mental health dysfunction, when I'm talking about an extreme, you find that a teenage boy goes and attempts suicide. And when you speak to the parents, they say that everything was okay. We didn't know things were not okay.
Right.
I think in this fast life which we are living, I think there's not enough time to actually communicate. I mean, there is family time, you're doing a lot of things together, but there is no individual time between parents and children. It's not always a group that is functioning. There has to be individual relationships between the kids and the mother, between the kids and the father, similarly between the siblings, between each other. So I think this individual communication is sometimes lacking. And it's quite unfortunate that parents are unaware that the children are so distressed even when they attempt self harm.
Yeah. No, I think you made a very valid point that, very often, like, even it comes up in schools where, the parents are not aware of what the child is going through, whether it's, something as simple as like an eating disorder. You may miss those signs because, especially in, young boys, because over exercising is seen as pretty normal, that, they are very sporty, they are very athletic. So you may miss those signs that, okay, there is something wrong. But as you said, first look out for behavioral patterns. Another thing is that, you mentioned, like, we have this whole nurture versus nature debate, which has been there in psychology for like decades. So where do you think, in terms of the nurture element, that a child's environment and their early childhood experiences play a role, in their mental health and their development?
So when you talk about mental health, it's always seed and soil, and not all, but in some mental health issues, family history is important. Means you have a certain genetic susceptibility. I think for a mother who's had more than one child, or even twins for that matter, you realize that the temperament of each child in the initial months of life is also different. So I think we are all born with a certain temperament. Some are a little more gregarious and more cheerful and more outgoing. Some children are more quiet and maybe a little introverted. So you find different spectrum, and that's what gives flavor to life. You don't have to be exactly the same. So these personality differences are seen very early in life. So there is a genetic component, but not always. But what is important to realize that even if you have a genetic susceptibility, if the environment is good, then most children do really well despite the genetic problem. So it is said that genes load the gun, but the environment pulls the trigger. I think the environment is very important. So when we talk about the child, what kind of environment are we talking about? We are talking about the family. That's the most important. And we are talking about the school. This is equally important. So I think the influence of the family and the influence of the school in a child's life are very, very important, and they play a major role.
I think you mentioned two very important aspects, of a child's life, which is their family and their school. And I would like to discuss both with you individually. So first, in terms of the family aspect, how do you think, the family can better support a child in terms of, their mental health, and where do you see problems coming up in that space?
So we must realize that parents have the best intention and they all come out with the best foot forward. However, we must realize that parents are themselves individuals. They have their own problems, they have their own baggage. Good intention is not good enough. And despite their best attempt and best intentions, sometimes things are not quite okay. For example, you may have a marital dispute, there may be marital disturbance, and the family structure may not be okay for children. Sometimes you may have one of the parents who is unemployed, but there may be poverty. There may be substance abuse or alcohol abuse in one family. There may be a mental health issue. There may be social problems, social isolation. The family structure is important. Now, it's quite utopian to think that the family is going to be absolutely fine, but it isn't. So the family plays a major role, and parents should try to have a very stable environment for the child, and they do their best as far as that is concerned. So these are the different family triggers. So for a child who is a broken family, if there's a father who is mentally unwell, there is child abuse, you might be surprised to find that almost 60% of children have experienced some sort of stress in their life. So post-traumatic stress disorder, which we talk about, is seen in almost 60%. And some of it is unavoidable. It may be bereavement of a close family member, it may be parental discord. So if you total all these things together, almost 60% have some problem or the other. But most children are resilient and they come out of it. The family structure is strong and supportive. So the family is, I think, very important. The family is concerned. Now, all these things you can't really control, but it's called secondary prevention. So when you have a child at risk, the parent should be able to identify that this child needs attention. So a child who has academic difficulties, a child who has chronic physical ill health, this is very important and often forgotten. Like for example, a child may have a congenital heart disease or a very severe asthma which limits his going out and playing and things like that. You may have neurological problems, you may have epilepsy, you may have a whole lot of chronic illnesses which account for a large number of children. They may have developmental difficulties. So these are children who are at risk. So risk factors have to be particularly attended to by parents so that they can be referred at an early stage for mental health issues.
And coming to the school element, how do you feel that schools can better promote student mental health and well-being?
So I think the most important thing, and this is something which a lot of schools are doing, is they're employing school psychologists and counselors. And what they've seen is that schools which have counselors, almost they have a 10 times higher incidence of children seeking help. So these psychology counselors, they are able to connect between the teacher and the child, between the parents and the teachers, and between the parents. And so having a counselor is extremely important, but not all schools have the resources to do it. The second thing is schools have to be really inclusive. Means irrespective of your gender, your academic performance, your abilities to succeed at school, all children must feel included and feel good about being in school. The second and very important thing is really bullying. And one aspect which is extremely important and has grave long-term repercussions is bullying. And schools must really have a zero tolerance towards bullying. It happens in the best of schools, it is probably inevitable, but there are manuals written on how to identify and how to rectify it. This is something which is very important. Another intervention which a lot of schools do, and one has seen very good results, is education. When a school teaches adolescents that how to manage relationship problems, about the problems of substance abuse, about the problems of self-harm, that mental health issues exist, and particularly when older children talk about it, then this goes very well with the younger children. So awareness is something which if schools create, and many are doing it now, but not adequately. Not all schools have the resources. But schools which do this, I think it makes a lot of difference. It's also important, this is prevention, but schools should identify things early. So any child with, again, academic problems, who's not doing well, seems to be a bit of a loner, doesn't have enough friends, they should be referred. So I think identifying early and sending to a counselor is also very important.
Okay, and another thing, which you laid a lot of emphasis on, like when we were speaking now, is that, resilience in children, that if children are resilient, they are going to do better and they are going to slowly, move from that surviving to thriving. How do you feel we can help children become a little more emotionally resilient?
So one of the counselors had talked about the goal of parenting, and they said something very effectively that the main purpose of parenting is to make a child feel lovable and make a child feel capable. So if you look at lovable means self-love, capable means self-confidence. And when there is self-love and self-confidence, this gives rise to self-esteem. Two things we have to give our children. It's to make the child feel lovable and make the child feel capable. So if you have these qualities which come from parenting influences, then that goes a long way. So I think self-confidence and self-esteem is extremely important. The second much talked about aspect of parenting which allows children to become resilient is allowing them to fail. And what this means is that there's a lot of what everybody knows now. It's called helicopter parenting. The parents
Right.
are so protective. They are hovering around the children all the time. That the moment the child is in trouble, they swoop down and come and help and see that their delicate child is not harmed or not psychologically upset. But children need to face difficulties. They need to have failures. They need to get back on their feet again, and they have to succeed with their own effort. So this helicopter parenting is not good, and a little bit of failure they should learn to tolerate. Similarly, criticism. I think for a child, if the child is criticized when there is failure for not doing well, not being smart enough, not working hard enough, this is demotivating. So people sometimes feel that praise spoils. Not so. Inappropriate praise may not be okay, but praise is the best motivator. And overall, if you see the structure in parenting, probably 10 times the children are criticized and 3 times praised. I think the ratio should be 9 to 1. Criticism should be constructive and once, and praise should be 9 times. So praising gives rise to confidence. Basically, resilience means the ability to try, fail, and try again. And
Yeah.
this happens only with confidence and a nurturing environment. And this is a very, very important point.
I think, as you mentioned very clearly, that fear of failure, which has been there through the generations, I don't think any generation so far has really managed to break that cycle. So if a parent has had grown up with the fear of failure, it has sort of, they've inculcated that into the child that, it's not okay to fail. So maybe, as you said, once we're more accepting of children failing or just not being perfect per se, like if you're accepting that, yes, you can be human, yes, you can have a struggle, I think that will probably even ease a lot of mental health issues in children, because that unnecessary pressure which they've put on themselves or the unrealistic demands, that would probably come down.
I think this is a very important point you made, that love for a child should be unconditional and not based on performance, not based on appearance, not based on athletic abilities. And that is why when you have a child, never say that you're very clever. You have to say that you work very hard and we appreciate the effort you put in. Never tell somebody that you're looking very handsome or very beautiful. Say that you're taking good care, you're very fit, and you're looking eating an appropriate diet, and you look well turned out. So praise the effort and not the quality. I think this is very important.
I think that's something very important you highlighted. And one more thing that I've seen like in experience is that, when you praise a child, like typically the comments that children hear are, oh, you know what, you've lost weight or you've put on weight. And you're looking, fit or healthy. And unfortunately, you don't know what that's gonna do to the child. So when we're talking to children, as you said, it's so important to go beyond like experience, like experiences, appearances, and just talk to them about who they are as a person, that okay, you're very creative or any of that, like if we can focus on like non-physical appearance based things or non-academic things, that would probably help children a bit more. So in terms of moving ahead, when we talk about like helping children express themselves, how can we encourage them to have that conversation and express themselves better when it comes to their mental
So I think this is a very important topic now, and this is referred to as emotional awareness or emotional literacy. And what is important to realize is that if you identify your emotion, particularly a negative emotion, once you identify it, then you can respond to it. So, for example, if a child is upset, doesn't realize it, and then reacts, then that reaction is usually inappropriate.
health?
So, I think
Right.
the difference is between reaction and responding. So, when you react without thinking, you generally land into. So, once you're aware that you're upset, or you're jealous, or you're angry, or any of these emotions, then you take a step back, you identify the emotions, and then instead of reacting, you're able to respond. So, I think identifying emotions is the first step. And this is possible only if the parents role model. So if the parents role model that they have emotional upsets and express it, then the children know that it's okay to be emotionally disturbed, but that there are ways to come out of it. So this emotional awareness is very important. And for this, it's important that there should be no stigma. So if you express that you're anxious, or if you express that you're
Right.
angry, or if you express that you're depressed, It should not be that the parent says that what are you depressed about? You've got everything. What is there to be depressed? So it's not like that. I think the parent should realize that these are all normal emotions. And the parents should nurture the child's self-awareness so that they are able to come over it more easily.
I think, as you said, that, role modeling and sort of creating those safe spaces can play a very big role. But do you feel somewhere also that kind of like in terms of recognizing our emotions, that the language we use, or, the language that even teachers use in schools, that sometimes that can be very problematic. Like, for instance, sad and depressed are often said to be okay. Like, use a better adjective. Why don't you say depressed? Instead of worried, write anxious. Instead of moody, just say bipolar. So, somewhere do you think that that is also causing a problem? In terms of recognizing how you're really feeling.
So I think it's good that this awareness has come about. In fact, I find a lot of parents with these emotion cards which children come with. So the more educated parents come with emotion cards and they label and say, I'm upset and I'm angry and I'm depressed and all that. So I think this awareness is fortunately coming. And I agree with labeling emotions appropriately in a natural way. It's children to realize what their emotional state is. That's a good thing.
No, so I think, like, are there any self-care techniques that you would encourage for children? Because, like, when it comes to adult mental health, a very big piece is that, adults are told that, practice some self-care. Just typically something like, journaling, meditation, like, exercising. So is there anything specific you would recommend for children which, they can do easily, or, a parent could supervise easily depending on various age groups?
I think this is a very important question and a neglected topic. For example, all of us pay a lot of attention, or parents pay a lot of attention to the food the child eats. Very important. The amount of exercise the child does. Very important. Because this is important for physical health. We pay a lot of attention. We earn a lot of money so that we can pay fees for the children and tuition so that they do academically well. This ultimately leads to economic prosperity. So there's a lot of spent on physical health, going to a doctor, and academic health, which leads to some economic success. But considering that 20% of the adults have some mental health issue and 10% of the children have mental health issues, are we spending enough time to make children emotionally strong? And this is where your question is important, that can we do something to make them more resilient? If you look at what a child needs to do, I think the most important thing is social connection. And for those who haven't seen the Harvard study on happiness, it's there on YouTube. Excellent lectures and excellent articles. They tell you that the ultimate happiness is based on your social connection. So beyond money and beyond physical health, which are very important, if you're socially connected, if your social relationships are good, if your family relationships are good, then this is a very important aspect in reducing mental disturbance. It's very important. The second thing what they have found is that your connection with the community. So communities will live horizontally, where there is an intermingling of the different communities. This is extremely important. And the third thing is that all children should have some sense of purpose in terms of social activity. And what they found in this Harvard study is that children and adults who are connected with the community and doing something for others, the level of mental health disturbances is much lower. So I think it's very important that we look after ourselves. We have to be physically healthy. We have to have some amount of economic prosperity. But we have to have engagement with our families, with our social community, and some social connections. Because these are very, very important ingredients of mental satisfaction in life.
Like, for instance, let's say a child is, an introvert. They're not very high on, let's say socializing and interacting with other people. So for them, would you say like, self-care activities would be like, okay, yes, helping others is a very important part of it. But would you also say things like, okay, do something creative, or, like, I know journaling often for very small children is not possible, but, something like some creative activity or some creative therapeutic activity, whether it's art, dance, drama, like, do you think those things would be recommended for children to sort of, take care of themselves
Good
over?
point. Stop a minute. Absolutely. I think social activities, sports, music, and any activity where you're engrossed and you have a passion towards are very important to keep you mentally happy. Absolutely.
So I think signing off, I'm going to ask you one last question, and that's going to be that if you could give any piece of advice to someone who's watching this right now and is having a hard time with their mental health, what would that be?
I think the first thing is to acknowledge that it exists. The second is not feel bad to acknowledge it. It is not a sign of mental weakness or lack of strength of character. It's something which is common and it's normal. Just like you're physically unwell, you can be mentally unwell. Remember that most people who need some mental help don't get it because they're very anxious. A lot of people say things like, I don't want to go down that black hole and meet psychologists because they feel it has a very negative connotation. This is totally untrue. When you meet a psychologist or a mental health professional, I think when you go there and you seek help, most people who go to professionals land up doing extremely well. One has to be very, very positive and optimistic about mental health issues. That it's common, it's normal, and you should seek, and the outcome for treatment is extremely good. And it doesn't mean that you have to live with it for the rest of your life. It does mean that this is how I am by nature and this is how my life is going to be. I think seeking help and taking help is extremely.
No, I'm going to interrupt you and make you just put in like one more thing to that, which a lot of people have misconceptions about. You know, you being in the space you are, you can throw just a little light, is on the aspect of taking medication. I know I said that was my last question, but you know that it's okay to be on medication as well, right? I mean, people have a lot of worries around it, that am I going to, you know, once I start, can I stop? Like all those kinds of concerns when it comes to taking psychiatric medication.
So there are two aspects to this. In children in particular, medications are rarely used. Most problems in children are sorted by family therapy, by counseling, sometimes by cognitive therapy, and environmental manipulation, and things like that. So children don't need medication often. Adolescents, if the history is long and if it's severe, sometimes do need medication. But we must realize that whenever you have a mental health problem, I mean a severe mental health problem, then you have a short term to medium term goal and you have a long term goal. Sometimes, if you're really unwell, then all the counseling and the other strategies which we use don't work. They take time and they are slow. So, if you're really feeling low, then taking tablets or medication for a short term period, maybe 3 to 6 months or maybe 9 months, it pulls you out of that state. And then the medium term to long term goal is through behavior therapy, counseling, and things like that. So medicines have a small role in pediatrics. If you need it, you have to take it. It pulls you out if you are really severely affected very effectively. And then the long term goal is by counseling. So one should not fear medications. They are not often used, but they are safe and they really work well and it gets you out of it.
Awesome. Thank you so much. That's been, you know, a very, very enriching session. And we really appreciate you taking out time and being with us and sharing all your insights. And for anybody who is watching this, listening to this, please know that, you know, if you or anybody you know is having a hard time with your mental health, please reach out, seek help. You know, as even doctor said, it gets better and you deserve to feel better. So thank you. And till the next time, please stay well, stay healthy.